Hello and welcome to Western Sydney Community Forum's interactive live stream forum. Sorry, we had some technical issues there for a moment. So my name is Billie Sankovic and I am your host for today's session. So I'd like to start by acknowledging the traditional custodians of the many lands that we're meeting on here today for our session. So I'm personally standing on Tharawal land in southwestern Sydney, and I'd like to pay my respects to elders on this land and beyond, both past, present, and of course future. I also like to acknowledge with respect Aboriginal friends and colleagues that are meeting here with us today. So thank you for joining us today. As you may know, the Western Sydney Community Forum interactive live stream forums are really a series of sessions that bring together community services, stakeholders and other providers across Western Sydney, particularly during this COVID period. And the sessions provide information and also have some really important and critical discussions about the current environment that we're working in. And they also provide a platform for sharing of tools and resources. So today's session, we will look at life on the front line of services to communities and across specifically the vast community services sector of Greater Western Sydney. So of course, we've all been experiencing COVID now for months and it continues to be a challenge, and we're really not sure what the future looks like. And the front line and the workers across the community services sector have been essential, not just to support and to continue to support people who are experiencing vulnerability and crisis, but also to prevent people from moving into vulnerability and crisis. And to do this effectively, the health and wellbeing of frontline workers and agencies is essential. So today we want to touch on some of these issues, both at a practice level and at a policy level. So before I do introduce our panelists for today, I'd just like to remind you that this is an interactive session. So we really encourage you to join the conversation if you have a question or if you would like to make a comment. So you can do that by raising your hand and we'll bring you into the session, or you can post your question or comment on the Q&A function on your screen. So on that note, I would like to introduce our panelists for today. So firstly, I'd like to introduce Kamal Dabboussy. Kamal is the CEO of Western Sydney Migrant Resource Centre. Kamal, thanks so much for being here with us today.
Thank you very much, Billie. Happy to be here.
Right, thank you. Kath Harrison, the CEO of Belong Blue Mountains. Kath, welcome.
Welcome. Thank you. Thank you. Thank you for being for asking me to be part of this.
Yeah, thanks for being here, Kath, from the beautiful Blue Mountains. Love your background, all those trees. Trees, not like mine, you know.
I've got a very old garden. Yeah.
Gorgeous. And I'd also like to introduce Stacey Stynes, and Stacey heads up the Youth Refuge at Core Community Services. Stacey, thanks so much for being here.
That's all right. Thank you. Thanks for having me.
Okay, so look, let's not beat around the bush, guys. Let's get straight to it. You know, there's been a strong argument and there's been plenty of evidence from the front line that workers in the sector on the front line have been left out in the cold as essential workers. Let's be clear about that from the outset to frame our discussion. And I think especially when it comes to policy decisions that are needed to sort of accelerate and boost investment in the front line. So, you know, it's been felt acutely by essential workers in the community services sector. You know, the COVID outbreak, it's been a time of immense change and stress for many industries, but, you know, especially for essential workers and in the community services sector, be they social workers, case workers, community workers, youth workers for that matter, whatever it might be. So within this context, Kamal, Kath, Stacey, you all come from really different and diverse places and organisations across Western Sydney. and you've had to manage and continue to manage not only your organisation but the frontline workers and the community members they support. So what I'd like to sort of hear from all of you, and we might start with you, Stacey, was COVID-19 and managing COVID-19 just about PPE and personal protective equipment? I mean, what are some of the other factors that you had to manage, things like staff wellbeing, transition to working remotely and delivering services off-site? Stacey?
Yeah, thank you for that. Because I manage the crisis refuge, so we haven't worked remotely at all. We've been frontline the whole time.
Yes.
Our facility is 24/7, so yeah, we have been on the front line and every day essentially, and no real opportunity to consider even working from home because the young people, don't have anywhere else to go. And I guess in the sense of managing the staff wellbeing has really been a roller coaster, and I think starting essentially with the young people, there's so much resilience that draws up through them. And I think that's what has been leading and keeping the staff feeling resilient as well, coming to work. But no, it hasn't. PPE is playing a great part, and we have been really fortunate to have access to personal protective equipment this whole journey. But the wellbeing, I think it has trickled down from the people and culture and support that we've had throughout the organisation, access to clinical supervision to make sure staff feel supported, but most of all, just really clear communication between the organisation as a whole, and really being honest at those times when we, we're really trying to break through the information we were getting from the health department of trying to navigate it all, and what did that look like for everybody, and just that transparency, I think, the whole time, and saying, okay, let's figure this out, what can we do? But whilst we're trying to do that on a management point, is really drawing through that staff resilience as well, and keeping everybody feeling optimistic at a time when you don't always have the answers.
Yes, absolutely. And I think working, providing a youth refuge, you can't possibly work offsite, of course, and it's been such a critical service at this time. Those priorities around staff health and wellbeing have been no doubt, critical. And whilst PPE has been easy to access, clearly there's been some other sort of challenges. Kath, I might just move to you as well. You're obviously in the Blue Mountains, and different landscape, different type of services. So COVID wasn't just about PPE, I'm sure. So what are some of the other factors that you had to manage? Things like staff wellbeing and transition, and delivering and providing service off-site.
Well, I think it's an immensely complex area for us to look at that. So the Blue Mountains is an interesting ribbon geography up and down the mountain. I think one of the issues around frontline service is that it's also grassroots service. So you don't need to be providing a frontline service from a site. And much of what's continued to be provided by Belong staff face-to-face has been mobile service with identified vulnerable client groups. For example, our disability client or participant group in our disability service, the very vulnerable aged care cohort that we look after, in our allied health services going out into community. So I think the issue for us was twofold. One is, how do we keep people safe, both physically in terms of health and emotional well-being, transitioning to different modes of practice and remote working. So not just working from home, but remotely.
Yes.
So that was the first thing, to be able to resource them to do that, and then the impost on the organisation to be able to do that, and then keep them safe in doing so. So for us, it wasn't about PPE, it was about safety broadly, and how did we do that in our sites? How did we do that with our mobile workforces? And how did we do that when we were all of a sudden needing to take critical private client documentation and put it out there so that people could be working remotely? And so we had the technical issues that we needed to get around, the staffing issues, and then the impost of working with vulnerable population groups and volunteers in vulnerable client groups. So completely reworking our models of care, getting us out remotely. And we did that in 10 days. We reworked all of our IT and then looked at what does this mean across the board. And one of the things that we've circled back to is we did a pretty good job of the one-dimensional stuff of, making sure people's workspaces in homes were safe. And we've got about 48 people working from their homes. What we didn't do was ask the questions about personal safety. So we are now, as we go on through this, are understanding much more deeply the impact of these, the transition and the change on people, and as it's embedded as really going forward as a flexible way of working. What does this mean for people in terms of their work-life balance? What does this mean for people who aren't safe in their home environments? How do we manage this going forward? So I'm not sure whether that was a reasonable response to you, Billie, but yeah, there we go. So no, not just about PPE safety, however, in the context of social, emotional and physical safety has been what's framed what we do.
Yeah, no, absolutely. And I think the vastness of the mountains, I think that, we forget about that. We forget that how long it takes to actually get from one end of the mountains to the other, and being, having to deliver a service within that context. And like you said, your staff, and it's not just about transitioning to home, but it's about somehow being able to, get your staff out there working remotely as well. And PPE is the least of, if you've got equipment, then you're able to deliver service.
And might I just end quickly, and I won't go on, but in terms of the technology, the reliance on technology. So in a geographical environment like this, where we have more dead spots than we have live spots sometimes, depending on where you are near the towers, it becomes immensely difficult. So we've had to look at investing funds to do things like put VoIP phones into workers who are working remotely, so that they can actually still have connectivity for their client loads. And a disability service has 172 clients. So that they need to be able to speak to, go out to. So we're still doing face-to-face, but mostly it's in a moderated way. And then our aging client group, where we surveyed them and they simply said they cannot deal with the technology. They don't want it. They'll use a telephone and they'll use a television.
Yes.
So what do we do around maintaining their psychological wellbeing and connection? And how do we support our staff through and our volunteers through? They signed up to provide a service that looked very different to the way we're needing to provide.
Absolutely. And that transition is, would have been extraordinary, like you said, redoing a whole new model of care. Now, Kamal, thank you, Kath. Kamal, just turning to you, and you provide a different service relative to the Youth Refuge that Stacey heads up, and the diversity of service that Kath heads up, and your focus is primarily on refugee, new and emerging communities. So, was COVID-19 just about PPE for you? What are some of the other factors and considerations that you had?
PPE certainly was a minor consideration. Like most agencies, we're doing multiple services, multiple contracts, multidisciplinary sort of organisations. So there are different demands in different parts of the organisation as well. But look, could I echo very strongly the disruption to work, the work from home, the safety for safety for staff working from home was actually a really big issue as well. So the work from home policies were existing, but they had to be rebuilt or reviewed and make sure that they were up to the task. Accountability measures were also having to be looked at, but much more importantly, it was about the well-being and the mental health of staff, whom are dealing with a very vulnerable and disconnected clientele to begin with, and they were quite often the main contact for those clients, and they also felt beyond whatever we put in place, a great sense of commitment to clients and wanting to go over and beyond and trying to meet their particular outcomes was really important for them. So what we were dealing with was the well-being of staff, and then putting their own expectations on the line. They were trying to do their normal workload whilst they're looking after children at home, whilst they're looking after, quite often 3 children with 3 different schooling options at home as well. So they were all really, really important to try and get the expectation levels right, to try and get the mental health issues right. We undertook staff surveys at the start of the exercise, trying to understand what people's concerns were, how they were feeling, taking a sort of pulse check. We got a wellbeing program established on a weekly basis for staff, which was just a way of connecting and a bit of diversion in that space, but allowed us to check in and connect to staff as well on a weekly basis. So the PPE equipment was the minor of our concerns. It really was about the factors of working from home, the transition from home, and trying to make decisions in the absence of clear information. What do you tell your staff and what do you tell your clients by extension? But how do you manage staff when in fact the information is quite often confusing, or that source of information wasn't regular, and you're having to operate on your own, as Kath said, social intelligence of decision makers, you're having to work on your own systems rather than what the direction is externally, and trying to support staff in that environment was a very difficult thing to do, but having our own systems in place was very helpful.
Yeah. Some really important points there, Kamal. I think, you've touched on, where did you get advice and where did you get information? I actually want to turn to that, and I want to turn to the policy environment in a moment. But we are actually already getting some questions in. So I might, at this early stage, bring in a few of those. So we've got a hand up. Anita Hannah has put her hand up. So Anita, if I can hear from you.
Hi, thanks everyone for joining the panel. I just wanted to ask specifically about mental health and wellbeing of staff. So how have you dealt with that, where there have been mental health issues, or have there been any mental health issues that have emerged, and how have you been able to deal with those?
Thank you, Anita. Kath, at Belong, have you had mental health issues emerge, and how have you managed that?
It's a very interesting question. Thank you, Anita, for it. I think the first part of my response would be that when we looked at doing this, we actually looked at preemptively what structures do we need to put into place to support this change. So we looked at our supervision policies and ensured that we had extended our clinical supervision to pick up the whole of the coordinating workforce, so that we extended our external clinical supervision. We reviewed with each of the individual directors how frequently we expected them to meet with and touch base with their staff. We put processes and procedures in place aligned to the policy changes around the working from home and working remotely, to ensure that we actually had connection, not about surveillance, but about actually knowing that the right people knew where people were and what they were doing on a daily basis, and that planning. So we reviewed our policies, our procedures, our protocols in line with the change, and upped resourcing where that was necessary, so that people have access not just to their internal supervisors, but in fact to clinical supervision. And we have that provided by a range of professionals, mostly psychologists and social workers, to work with our staff. What we then actually looked at was increasing the volunteer workforce. Now, we certainly have had some significant mental health issues arise in our volunteer workforces, where they have had their only source of connection removed. So that's been a very significant issue for us around how are we managing that grief, if you will, for those people who have lost the only kind of social connection that they've had. So it's that the duplicity of kind of working with your paid workforce around the delivery of service, and then managing the wellbeing of your volunteer workforce. So for us, it's about providing the structures that we can, making sure the structures work for our staff, ask them what they needed, as Kamal did in terms of the staff, what do you need going forward? We also have made ourselves more available. So one of the things is, so we've done the external supervision, increased the internal supervision, tried to develop our leadership structure so that we're doing really concise, clear and consistent messaging, and that we are meeting much more frequently with one another as what I would call our Executive Plus team. So we broadened that membership out, so it's got service managers in it as well as our directors and myself, so that, and we are dealing with those issues almost on a weekly basis. So the other thing I did was make myself available. So God, I didn't name this, the staff did, but I come on and do chat with the chief on a monthly basis. So anybody who wants to come in comes in on a monthly basis at a designated time, and they can talk about work issues, they can talk about whatever it is. And interestingly, I get different sets of people, and I've got about 15 every time I do it.
Yes.
We also did the social stuff, which is, you know, we are all existing in a social context, and we've taken away the ability of informal connection and conversation in workforces and the water cooler conversations. So we were attempting to replicate those. So we also have put in structures like we have, and again, I didn't name this, the staff did, we ran competitions. And it's called Thank Belong It's Friday. So we have drinkies on a Friday, actually, to maintain that kind of connection and the well-being and imbue a culture, you know, that we want. Yes. So a range of activity. Obviously, Kpis is available to people if they need it, and the Department of Communities and Justice has made that available as a funded component for part of a service. But we've actually dedicated the resources to do that. So I hope that answers the question.
Yeah, absolutely. And I guess it shows the diversity of strategies that are really needed, because when you are looking at mental health and supporting the wellbeing of staff on the front line, it can't be one isolated strategy, but sort of a diversity and a mix of strategies. Stacey and Kamal, did you have anything you would like to add in terms of managing mental health of frontline workers in your teams?
Look, I think I'd add that there were actually some mental health issues that came out through the process, and we had some acute issues and there were some longer term issues. So in the acute issues, we actually did have, as part of, because we have a hub structure, we have some other services that are embedded within our organisation. And towards the close down and working of remotely in those last couple of days, someone did test positive to COVID-19. Actually, there was two that was tested positive, and we had some staff that were potentially in the office at the same time. And managing that information flow and managing that bit of information whilst keeping the privacy requirements of the individuals that were infected as well was actually quite tough. And there was a lot of concern with that. And we had to spend a fair bit of time in communicating to staff, you know, what the policies are, what we're doing. We did things as out of an abundance of caution, and that actually in some cases created more issues for staff. But you know, the communication channels, keeping up that level of communication and people understanding as to, well, why we're making decisions and why we're doing things was really quite helpful. As we move on, the longer term issues, certainly the isolation, and when we're talking about frontline staff in the MRC, we've got to remember that a lot of our frontline staff are actually drawn directly from the communities that we're working with. Yes. And they are, you know, they're actually reflective, they're part of those communities. So if our communities are facing isolation and mental health stresses, then our frontline staff are also facing that as well. So they, you know, they were not isolated from their respective communities. So that, you know, there's a real information flow, and yes, supervision, external supervision, trying to get support and help. The directors checking in on a regular basis. And I've got to give a shout out at this stage. You know, there are 3 or 4 people in the office who do spend a lot of time supporting the frontline staff. So none of this happens without their support, and it's been essential in getting this through as well. So it is that regular check-in, it is those weekly meetings, it is that staff meeting opportunities that have really helped in that process and addressing the mental health. But the acute issues have taken a fair bit of time on occasion in trying to address when they've come up.
Yeah, some really similar strategies there between, you know, the MRC and Belong. Stacey, what about in a youth refuge context, managing sort of mental health issues of staff? And we've got lots of questions and comments coming through, so I'm going to keep with that after your comments, Stacey.
Okay, yeah, so thank you. I mean, we've gone through different stages, I guess, from being right in the mix, because we're in the Liverpool Fairfield LGA. So we had the first wave of COVID in the lockdown, was really trying for, I guess, some of the staff, and mostly impacted from the emotions that was going on with a lot of our young people. The lockdown was when the schools shut, was really, really difficult for a lot of the staff, because, and I give praise to each and every member of my team, because they went from being a youth worker to all of a sudden being everything for these young people. You know, they had to put the teacher hat on, they had to put the, you know, we had 6 young people at home all day, every day. They had to put the counsellor hat on, the mediation hat on, the entertainer, the football player. They had to be everything for these young people. And it was a really stressful time. And we were lucky to sit down with the management team and really figure out what we were going to do about this. And we extended the team, and we brought in more staff onto the floor to make sure that the staff weren't feeling exhausted or overwhelmed in trying to maintain the young people. And especially like for the young people, these are young people that are living away from home. So they really thrive on the whole community to bring them up. And, you know, when they have those interactions with their teachers and, you know, with their friends, that was completely withdrawn from them. So just trying to support the staff and to support the young people in what they were going through. But we were lucky to have that flexibility of our work practices to make sure that the team felt really supported in their multiple job roles that they were doing at the time. And this time round, it feels a little bit different. I feel that although we're right in the middle of the hotspots, I feel in one sense we're a bit more prepared, and we're really talking about it almost daily and how that's impacting everybody's, you know, ability, but also a little bit, I feel like people are feeling a bit over it now as well, and looking at what that looks like in regards to people's mental health and managing that every day. I think there is almost a sense of we can do this the first time round, and now it's like, okay, yeah, we're still here. So just talking about that and what that looks like and how that feels, and how we're managing the young people through that as well.
Yeah, thank you for that, Stacey. And I guess it's really different when you're in that sort of 24-hour service emergency accommodation environment. There's got to be some specific challenges in terms of staff wellbeing and supporting the health of frontline workers. So just I'm going to please thank you for all the questions coming through. And if you do have a question as well on the live stream, feel free to pop it there, and we'll bring that into the session as well. So I'm going to turn to some of the Q&A comments. Firstly, a drink with your colleague on Friday evening sounds like a good bonding strategy. I think that one's for you, Kath, for the belong, it's Friday. I really like that. There's also some comments here around you know, wonderful support structure at the Migrant Resource Centre, Kamal, and how the management team were able to make clear, direct communication to staff, providing a clear internal narrative. So that's some good feedback for you as well. Another comment, hats become heavy. The amazing contribution is outstanding. The level of resilience is truly inspiring. So some really lovely comments coming through from people in the sector. So thank you for those. I've got some questions I'd like to turn to here in relation to IT solutions. So you have mentioned some of that, particularly Kath, you mentioned, you know, the remote working, getting your staff out. So we've got a couple of questions from Dex Black. Thank you, Dex. Good to see you here. I'm very interested, Dex says, in hearing what specific IT solutions turned out to be most useful and directly applicable to more distributed and mobile services. Yeah, that's it in terms of the IT. So Stacey, any specific IT solutions? I know because your service didn't go remote and you still had to, you know, be on site. Did you see any shift or access any IT solutions as a result of the changing environment this year?
We did have to implement, we did have to do a lot of online working for schools, I guess, for our young people, and having to engage all the young people through online learning, which was pretty difficult at times, because just having the resources to make sure, and because young people having their own space, but also not having access to laptops and the technology that other young people may do.
Yeah.
We were quite fortunate to have access to some additional funding to make sure that everyone had the opportunity to get online and work from that kind of IT space. But other than and connecting to the rest of the organization, we've had some abilities to jump online and use the teams and the sessions, but it's mainly been trying to manage, from a face-to-face perspective for us.
Yeah, thanks, Stacey. And yeah, of course, I forgot about that. Even though you were delivering service on site, you still had young people who were learning from home. So obviously some key IT, you needed some key IT solutions. Kamal, any specific IT solutions that turned out to be most useful for you?
Well, I think we were a little fortunate in that prior to COVID hitting, we had actually spent a fair bit of time looking at our IT structures. So there's a lot of stuff that we were also, we were already putting into the cloud. We already had databases, CRMs that we were managing in a cloud-based structure, and the computers were just able to access from multiple locations. But similar to most other people, the issue for us wasn't about connectivity per se. That was a minor issue. It was about device management and the number of devices that we had and the number of devices that we could give to staff. And what we really did was looked at this, put in two-factor authentication through the organisation, which wasn't there prior to COVID hitting. So I think we were a bit fortunate in that we'd done a fair bit of work beforehand, but still device management was a little bit of a challenge, and remains a little bit of a challenge, because when it first hit, trying to buy laptops and extra mobile phones was almost impossible. The market didn't have anything at that point in time. So that's since sorted. It's a bit further out, but that was our challenge, and I think we were fortunate in that we'd done a fair bit of work before the COVID-19 disruption hit.
Yeah, and I guess that was important, an important foundation, which meant you could sort of transition a bit more quickly. And Kamal, just on, comments come in from Norma saying, well done, Western Sydney Migrant Resource Centre. So I think that's a shout out to you.
Thank you very much, Norma.
Kath, what about you? Was there any sort of specific IT solutions that turned out to be most useful, especially sort of having your staff moving across the mountains remotely?
We looked at reconfiguring our servers, obviously our CRMs, and much of what we do is cloud-based as well. So we reconfigured, and we actually sent all of our staff out with Belong Blue Mountains equipment, because much of what we do is case work or case management, and the whole issue of privacy and cybersecurity. All of our staff are working only on Belong Blue Mountains equipment. So we sent them out with laptops, or in some instances with their actual desktops, including their chairs and their keyboards, to set them up so that we could maintain the integrity of our data and our client data. By contract, we have to. So, and very rigid kind of, well, not rigid, but robust policy and protocol around what you can and cannot do when you are working remotely. So not downloading documents, because we can only guarantee the safety of the information whilst it's running through our own services. Yep. So we actually had the firewalls reviewed and enhanced, and so I have everybody working off Belong equipment. The other issue we did with those services who actually are out in the community doing the face-to-face, and we've got a number of those where it's still necessary, is we have them out with equipment. So either tablets with keyboards, so they work like a computer, so that we're actually using some telehealth stuff with particularly our allied health staff. Components with that, and things where people can actually sign their contracts on the screen. So we've looked at what did it look like in a paper-based version, what do we need to do with it as an electronic version, and how do we actually make that happen? So,
well, Kath, I might ask you another question that's come on the panel, also from Dex. Thanks, Dex. Is about that point, and so I really just want to unpack that just a little bit more. So, so which tools, was there something in particular that wasn't available, or was unaffordable for you as a community organisation to be able to do that, to transition?
One of the the answer to that, similarly to Kamal, was that we had done a lot of work in our IT as the kind of going forward. So that was just opportunistic and serendipitous. That had actually been done. I think the issue, however, is the cost. The cost of this going forward, if that's what we have to do, is exorbitant. If you're looking at smaller organisations, and we were able to roll over parts of our funding contracts to support IT. We've also looked to work with some of our isolated clients the same way, where we can put equipment into their homes and support them with connectivity and training. We're doing a bit of that, and our IT staff are doing that. But there is a significant cost to that. I could give you the dollar figure, but it would make your eyes water. Yeah.
Yes, I know from the forum's perspective, we've certainly had to transition really rapidly to digital services, given the type of services we provide. And, you know, there's plenty of ideas, plenty of opportunities, lots we can do, but we just can't afford it. So, you know, that's a really important factor. Yes, look, was there anything else you wanted to say, Kath?
I think again, the reliance on technology works for the provider. It doesn't always work for the our endpoint clients.
End user, exactly. Such a good point.
And what do we do to enable in the digital world? This is our challenge. You know, like, how do we maintain connectivity with our participant bases who perhaps don't have access or the resourcing to be able to do this, and then how do we support them going forward? So it's loaded. So to answer Dex's question is, yes, there was significant resource. We bought 17 new smartphones. We bought 10 new laptops to enable us to do this, and we've bought equipment for some of our clients. Now, that's not everyone can do that.
Yeah, that's right.
All
right. Sorry, Kamal, were you going to add to that?
I was just going to add to that. You talk about cost impost. The cost impost also on staffing to actually support clients to connect. A lot of the clients have an email address which they've only used to set up for MyGov, and they've never used it again. Yes. So just the time and resources the frontline staff have to support clients to connect where they've got connectivity availability is huge. And then you've got a large number of clients that actually just can't connect at all and still rely on that human contact, which has been quite a large demand on services. You know, where the connectivity is and where it isn't is actually quite interesting, and I think led into your forum from last session about IT connectivity. But the staffing costs are not just the hard cost of device and IT; it's also staff time. The enormous amount of staff time in trying to support clients to connect has been for us immeasurable at the moment.
Yeah.
I just talk to the risks. Just back to Dex. The risks also involved broadly when you're using digital platforms. So the other issue, I think, is the risks that if you don't have, if your staff are thinking, that's a good app, I'll bring it down and I'll use that on my phone, or I'll put this on my computer, that the phishing that's going on in COVID world in terms of using technology and scamming, again and around data, becomes critical in terms of what you control and what you don't. So this is a really complex area, and we need more help around it, I think.
Absolutely. And that's actually a really good segue to my next question. Now, Shay and Raphael, I saw that you had your hands up and I was getting to you. You've put your hand down. Feel free to pop your hand up again. It'd be great to bring you into the session, and we will get to the other questions shortly. But before we go to that, I want to move to that policy sort of environment. Now, workers in the community services sector are essential workers, as we said. There's no question about that. So while we don't really hear much about the community services sector as essential workers in the public realm, and there's little, if any, sort of public dialogue or discussion about that, where do you, as an essential service, find advice and leadership during that sort of during the breakout? The outbreak of COVID, and also was that leadership and that advice useful for you in the context of being essential services on the ground? Stacey.
Hi, yeah, we were quite, I felt like we were quite well directed. Had we had quite a lot of engagement with Department of Community Justice Service. So my managing director and myself would sit down and go through a lot of the things that were sending us through, the policies, procedures and frameworks for us to follow. And it was, yeah, we were quite supported as a team to delve into what the directory was, but also to provide quite a lot of feedback to the department on what our strategies were. And they acted quite rapidly. I mean, it was a very fun couple of weeks, but yeah, they demanded those answers from us quite quickly. And even in regards to like the support services and going back to what we needed to be able to make the service run and run safely was provided to us, and even additional funding was there for us to be able to do what we needed to do, and quite quickly from the department. And I mean, we work very closely under them, so yeah.
Yeah. So that's some really positive feedback, and that reflects, no doubt, the context that you work in as a homelessness support service and the nature of your work. Kamal, from your perspective, you know, what are some of the policy and investment opportunities and failures, for that matter? You know, is it too late to get some things right that fell through the gaps? And is there anything looming that we need to be thinking about at that policy level, and especially when it comes to advice and leadership around managing essential services?
Well, look, I think every organisation could probably give you a slightly different experience. Our experience was significantly different in respects to leadership and information flow to us. Certainly, governments that were holding the contracts were flexible in meeting KPIs and changing some shifting sands and accommodating that requirement. But really, the decisions that we needed to make day to day, the decisions that we needed to make regarding the work from home or the protection of staff or what was happening and the advice to give to people, to us wasn't flowing to us. We had information that was flowing to the media, we had information that was flowing to local members of parliament, but considering that government have novated a lot of services out to the not-for-profit sector, we weren't actually then included in that formalised information flow. So, you know, even to tell us where the pop-up clinics were going to be, we weren't even getting that information. If we didn't go and seek that information, it wasn't coming to us. At the moment, it has improved a little bit, but it's sort of improved secondhand, whereas a Multicultural New South Wales are sending us a lot of translated information from the Department of Health. That is coming to us via them. It's not coming directly from from Health. And whilst I think there are attempts to try and improve that at the moment, I do think that's been a failing. We weren't actually on the formalised information flow to be able to make decisions, and I think that's a real issue. We were resting very much on our information, on our protocols, on our risk management frameworks, on our COVID response policies, and we were applying them quite often in a vacuum of that leadership and information. So I think that needs to improve. The other factor that I think is a really important point to look forward is the flexibility that we now are working in, and we expect from the environment with respect to COVID. Some of those issues will remain for years to come and possibly will impact our working relationship going forward, full stop. How, in fact, the legal framework, whether it be the award structures, whether it be payment points and accountability structures, how that will change moving forward. And I don't think we've quite unpacked that as yet. We haven't had the time to, but I think they're going to be things moving forward that are going to make an impact for us.
Yeah, and that, you know, Kamal, thank you for highlighting that extraordinarily important work of the community services sector in terms of being a conduit, yeah, and a way to you know, to get information from that sort of broader public health or policy level to local communities, and how important it is for the sector to be part of that conversation. Raphael, I'm going to ask you to come in a moment, but before I do, Kath, so yeah, policy. What opportunities were there? Were there any failures?
Look, I think I would probably mirror very much what Stacey and Kamal have already said. I think Interestingly for us, Stacey, DCJ were late to the party around the directions around this is what you need to do. And very early on in writing, they said, keep providing service, keep providing service, keep providing service. And I think it took them a little while to get around, hang on, what does this actually mean? So that it came to our own internal decision-making policies, procedures, just to mirror what Kamal was saying. That's how we managed it. The diversity of belong means we have multiple funders at both federal and state levels. So we chose what were the trusted sources where we would pull the information. So we're doing an awful lot. It's not pushed out to us. We're pulling it down.
Yes, yes.
So we've done the bring it down, and we've put our internal structures in place where we've got designated people at designated times on day, sometimes daily. We pull down the hotspot information daily. Yes. And disseminate that to our staff. So from a policy procedure, I think it's the issue of the third sector as essential. And that's a much broader debate that needs to be had, is recognition of the enormous fabric in the third sector, the community sector, that is not actually being picked up in the construct of essential service in the psyche of the community or politicians or policymakers. That would be my one say in that. I think the other really important thing for us is, I'd like to say, our contracts are certainly they're being flexible at the moment. They're understanding COVID, but they're not changing. They're not changing them. They're not actually altering the KPIs or the actual outcome or output measures that are being expected. They're just acknowledging that, you know, you're not going to meet them. So there's some anxiety around that in my organisation with directors around, well, we have no fail safe. So that's an important issue, I think, in terms of policy. There's two other things I'd like to raise. One is around quality and accreditation services. So those kinds of structures around have not stopped. So this organisation is looking to have to meet accreditation standards for disability and aged care in COVID. And I actually think that it's a double-edged sword. You want to know that the quality is there in a service, and I get that, but now is not the time. Now is not the time.
That's right. And you don't want to be directing resources to that, you know, particularly when your resources are limited and there's such a demand out there in the community for service. So it is really about investing. I mean, the double sword.
That issue needs to get picked up, I think, as a policy issue. The other is volunteers. So many, well, you can't insure for a pandemic, you can't insure for a pathogen. So where you've got high concentration volunteer workforces, they are not covered for illness. They are only covered for injury in many of the generalist community sector services. So you have whole workforces. Like, I take millions of dollars into social inclusion programs that are premised on volunteer workforces. That's going to have to get looked at into the future, because the risks are too great to put people in. So that would be my take.
Yeah, thanks for that, Kath, and some really important considerations. And I think that, you know, it's not just about practice, it's also about that policy level. So I might now go to, we've got so many questions and we'll try to work through as many of them as possible. We've only got about 10 minutes left. So Raphael, if you can come into the session, thanks for your patience and sitting there. Lucky you didn't have to actually hold your hand up, it would have been sore by now. So Raphael, what's your question?
Thanks, Billie, and hello, everyone, for this wonderful opportunity to discuss such a crucial issue. I've got a few comments and the questions, but for the sake of time, maybe I hope the questions that I put in writing are there. I don't have to repeat them, hopefully. But my first comment was in reaction to Anita's question about if there are any mental health issues that may have come across. I may talk from the other end, from the other perspective, as a community engagement worker, and also wanted to add to what Kamal said about frontline workers being also part of the community. So we come to work, we're coming from a community, and after work we go back to that community. So that means the issues that are in the community are also ours, in addition to those that we get from our work. So on the way to work from home and at work, we face issues. And obviously, like for example, if I speak for myself, there is another, for us, it's a double pandemic actually, because also we have families overseas, and that's also another burden. We are a lot of anxiety, a lot of depression that we see here in the community. People worried not only about getting the pandemic here from work or from the community, but also the situation back home. People have families there, children, parents, siblings, and we don't know what is happening there. So that's also another factor that we can't really shut a blind eye on it. So it also affects us. Coming back to here, I was actually curious if people who didn't get the opportunity to work from home, if others got that opportunity, do we know who was lucky? Those who didn't have to travel to go to work and were allowed to work from home, or those who were allowed to keep going to work? What is the most risky? Is it to work from home? What are the advantages? I don't know if there is any comparison that has been made so far, because we know some people got the opportunity to work from home, others didn't. I'm not really clear which way is safer, to keep working from work or going to work, or working from home. I don't know. I understand there are some advantages and some disadvantages, but I'm really interested to know, those who are talking to everyone, if there is, for example, Kamal, when you allowed your staff to work from home, did you consult them? Did the staff ask you for that, or it was just a wise decision from a manager? Thank you so much.
Yeah. I might, Raphael, thank you so much for your question. And there's, so much to think about, not only locally as a workforce, but globally as well. We are not just essential workers as an industry. We are also, community members ourselves, locally and globally. Now, Kamal, if you don't mind, I might respond, and then if you have anything to add. I mean, I guess the key thing to remember, Raphael, is that as all of us as leaders, we've lost Stacey, but she will hopefully be back shortly. But as leaders in organisations, there is a very clear public health directive, saying to businesses and organisations like us that if your staff can work from home, then they should continue to work from home, and that continues to be in place. And I think that is essentially what drives the decision making from leaders in organisations. Kamal, did you have anything you'd like to add to that?
The other thing I'll add to that, and recognise the public health objectives there, we have some communities, particularly families, that desperately want a service. So we're trying to balance out what we're trying to do. But we're in an interesting situation in which we've gone remote. We've actually started to introduce back some services from the office at the moment, but then we've had the Crossroads outbreak and Liverpool being declared a hotspot. So again, we've had to pull back a little bit as well. So the experience about working from home and working from the office, we are evaluating, but we've actually got this mixed environment at the moment. And I still think the evidence is not quite clear as exactly what is the most beneficial and what's not. We're still looking at that. We're still evaluating that sort of issue, but clearly a blended solution is going to be part of our future solutions.
Yes, absolutely. Okay, I'm just going to turn to some of the Q&As, and Sanal, I can see your hand up. I'll come back to you in a moment. Maybe just quickly, some comments from the panel. Two in particular. The first one is around industrial rights. Yeah. Did you, as an organisation, provide staff with paid COVID leave? And does this need to be factored into government funding or into employment conditions, firstly? And secondly, have you seen an exodus or a shift, the frontline leaving, and which has resulted in some staff turnover? Stacey, COVID leave. Stacey, you're on mute.
Unmute, Stacey.
Stacey, we can't hear you.
There you go, sorry.
Okay.
My computer completely cut out then and froze, so I've come in from my phone, so I hope it's okay. Yeah, we have a people and culture manager who's directing to us about the pay and what that involves for staff. As I said, because the staff is on full time, and there's even been more opportunity for staff to take extra shifts, and we've been very mindful to make sure we're looking after our casual pool, and so there's been no cut in the shifts. However, we do have to have that fine balance of you know, when we're having to ask a staff member to stay home if they've got any signs or symptoms, and what that really looks like for a staff member. So that's still being reviewed with our people and culture team at the moment. But because we are a shift pattern, so we are coming into contact with each other quite a lot out on the floor. So it really works different to that stay at home, because it's not necessarily possible. And in the eventual that did happen to a staff member, well, then the directory would come from the people and culture to look at the funding for staff.
And that's, you know, Stacey, again, I think Kath, you mentioned it, and you, Kamal, as well, that whole link between funding and the possibility of what you can and can't provide. So just quickly, Kath, do you provide COVID leave for staff?
Currently, by way of policy, we're saying that if you're sick, you're sick. This is a really interesting point, because if people are sick and they're at home, there's a bit of a belief that they can continue, you know, they'll continue to work because they're at home and they can, outside them having COVID. So it becomes complex when you've got people all of a sudden in a home environment. So our policies state that, you know, if you're unwell, it's your personal leave, you take your personal leave, and we look at that. In the event that someone required COVID leave to isolate because of close contact orders, then we would look at that and have that approved. Currently, our policies actually speak to the existing leave requirement, and it does become something that I think we are beholden as to actually role model what is best practice, because it's, you know, if you're sick and then you're at home, it's easy just to come on the computer, but I don't want that happening. You know, that's about the mental health and the well-being. Complex issue.
That's exactly right.
So
paid COVID leave without a funding stream behind it for some organisations, particularly in hotspots, is prohibitive, I would think.
Yeah. Kamal?
So I'll echo what Kath said. The only thing I would add is that we took a proactive response in respects to casual staff to make sure that they were protected in this space. So you know, normal paid staff had some entitlements. We provided some extra stuff for casuals.
Yeah, no, great. I mean, certainly at the forum, we provided additional days COVID-related leave, and that's not just for contracting COVID. It's also about, you know, having to look after children, for example, if they were at home, you know, that's still considered COVID impact leave, and we provided that additional. Okay, now we have run out of time. But I have noticed Sonal has had her hand up for a long time. So I'm going to take the liberty of just going a few minutes over. Sonal, can you ask your question quickly?
Thanks, Billie. Yeah, I have a question for Kamal and Kath as well. As Kath was talking about KPIs, and as a frontline workers, like your services need the frontline workers to organize community sessions, workshops, and how the supportive the managers in regards to meeting the KPIs, and what's the platform they are using to reach to the community journal?
Kath? Thank you, Sonal. Good question. Really important question.
Sonal, for us, actually, I've just come from a meeting earlier that was actually looking at this question. So we're looking at what does the new models of practice look like? And in the COVID world, what is it we can meet against our contracts, doing things differently, and us developing our own benchmarks, if you will. So we're looking at the internal work to develop our own benchmarks. And we are looking, in fact, and I've asked today that we actually hold a community forum about how are people doing it differently, what's needed, out there so that we can actually look to model things that meet the need in the COVID construction. I don't know whether that answers Sanal's question.
Yeah, thank you, Kath. Kamal?
So on the first question, we are also looking at what KPIs look like in the next year and next period of time. So there's a bit of work that we're doing in that space. In respects to community forums, we've actually already done 8 community forums, one in partnership with CORE as well, and we've got responses in the thousands, both on COVID, employment rights, and other related issues. So we actually suspended some of our activities and focused on those community workshops and developing some of those stuff as well. So we've had some success in those direct areas, and certainly, as I expressed earlier, we've been very active in trying to speak to staff about meeting KPIs because they had a commitment to them, and knowing that we weren't going to meet them, I wanted to make sure we reset expectations with staff for their own mental health, and they were aware that there was flexibility in that area. So that was actually a really important piece to do with people that were particularly stressed or had kids at home or were impacted in other ways.
Yeah, it's some really important considerations. Stacey, did you have anything to add in terms of meeting KPIs as a leader and leading that in your team?
I guess for us, our outcomes look very different, and some of the homelessness sector has been really blocked up. So in helping young people to move on independently has been quite difficult. So we've really had to reduce the look at outcomes and just manage everyone's kind of emotional well-being in regards to looking at the outcomes of social workers and how that impacts them and the cohort we work with.
Yeah, thank you for that, Stacey. Okay, we have gone over time. I always go over time and I always get in trouble for it because there's so much to talk about, and we haven't had a chance to get through all the questions, and there's been some great comments coming through. Kamal comments saying, good on you for looking after casual staff. It's and other comments coming through saying it's not fair for our staff to take unpaid leave when the reason they can't come to work is COVID related. So a really, really good point for us to think about. Some additions to your point, Kath, this issue of profile and resourcing hits the sector, and that's the profile of the sector as essential services and the profile generally of the role of the sector. Chris says, hi, Chris. Great to have you here, that it hits this sector with every emergency, not just COVID, and that in particular for you, Kath, rather, in the mountains, and Chris in the mountains too. You've just gone through an extraordinary, crisis with the bushfires and went straight from one to the other. And this came up when the bushfires were on as well. So yeah. Okay, so on that note, I'm just like to wrap up, and I'm sorry we didn't get to all the questions, and we'll certainly look at those and get back to you offline. Stacey, Kath, Kamal, I want to ask you one question and perhaps just a couple of words in response. And I know you want to unpack this one, but we haven't got time to unpack it. Maybe we can unpack it next time. So what's one piece of practice and policy advice that you give to ensure frontline workers are supported and able to deliver services to people experiencing vulnerability? So one bit of advice, Stacey.
Just to keep a foot of the information and just being transparent, I guess, and having those open conversations. The transparency is key, I think, here.
Yeah. And that's been resonated in today's conversation. Kamal?
Look, I'll echo that. I was actually just thinking to say something. We've got 2 ears and 1 mouth. We really need to understand the pressures and the expectations that frontline staff have. It was really important to understand what they were facing in order to help us make decisions as well. So we're getting information externally. We've got to really listen close to the information internally as well. So there were things that I didn't know that came through this exercise. So really listening very closely to what's happening.
Yes, thank you, Kamal. Kath, one piece of advice?
that you know your communities and your workforce knows the work that they do and the need that's out there, and that you will make decisions premised upon your community and your organisation's need. Don't put yourself up against any other organisation. Do what you know is right for your people, whether it's staff, whether it's your community.
Yes, yes, some sage advice there. Okay, on that note, thank you very much for being here with us today, Kamal, Kath and Stacey. It's been great to have this conversation, and always plenty more to discuss. And to everybody out there, both on the stream and those of you in the room with us, sorry we didn't get to all your questions today, but there's certainly some information there for us to discuss it at another time in another live stream. So thank you, Kamal Dabboussy, CEO of Western Sydney Migrant Resource Centre. Thank you, Kath Harrison, CEO of Belong Blue Mountains. Thanks, Kath. And thanks, Stacey Stynes, head of the Youth Refuge at Core Community Services. Thank you all, and I'll see you all soon, no doubt.
Thank you.
Thank you very much.
Thank you. Bye.
Bye-bye.
Okay, so, you know, as always, there's some great information that always comes through in the live streams, and there's some food for thought for us today, not only at a practice level, but at a policy level. And it really today emphasised the importance and the value of that information, that transparency, and working really closely and understanding and knowing your community. But one of the key things, I think, is the essential nature of the work and the essential workers that make up the community sector, not just in Greater Western Sydney, but nationally and no doubt globally as well. So some good discussion today. Just a reminder, Western Sydney Community Forum has sort of a number of different services, specific COVID-related services that are available for agencies across Greater Western Sydney. So feel free to head over to the website and find out what's available. And please feel free to contact us if you have any questions, or if there's anything in particular that you would like us to focus on or we can support you with. And, you know, we're always keen to speak with agencies, and certainly as a team we're always out there on the phone or on Zoom. Yes, we're all zoomed out too, just like you. So thanks everybody for attending, both here in the room and in the live stream, and take care. And yeah, we'll speak to you soon. Stay well and goodbye for now.